Hey guys, it's Callum. So today I'm going to do a video on what surgery I had, any of the questions that I got asked on TikTok. So first off, obviously, who was my surgeon? My surgeon, Mr. Mao from the London Cosmetic Surgery Partners, based at the Welbeck Clinic in West Marylebone way. I had double incision with him because, basically I wasn't eligible for any of the surgery. You had to be a specific size for peri and keyhole. I don't know what size that is. That's something you'd have to ask him or another surgeon. So double incisions, basically you have 2 scars underneath your chest and you have nipple realignment and reconstruction, so it's like the male size of a nipple. People say, do you have scar dysphoria? No, not really. They are what they are. If I didn't have to have scars, I wouldn't have had to have scars. It's that simple. It doesn't really bother me. People have scars here, there and everywhere normally, like from any of the surgery. So 2 scars on my chest don't bother me. They'll fade, like practically pretty faded now anyway, from putting bio oil and silicone scar gel on it. So no, to answer that one, absolutely not. They'll fade. Nothing I can do about it if I didn't have to have scars. Like I said, I wouldn't have chosen to have scars, but that is how it is. Another one, Mr. Elgamau, important one. I find a lot of people are scared about, including me. I was scared of it. Drains. No one really wants them. You like having 2 tubes out of your chest. No. I didn't have to have drains. Personally, I can't say it's going to be the same for you. From my own experience with Mr. Elgamau, I can't say that. From my own experience with him, he doesn't tend to use them. I know someone else, Parker Dunn, he had his top surgery with Mr. Elgamau, but he had peri. He didn't have to have drains, so he was happy with that as well. Mr. Elgamau just doesn't necessarily use them. I won't say he doesn't agree with them, but he just finds it. You have a cavity in the chest wall, so once tissue's taken out, you'll have your chest wall, you'll have skin, there'll be a bit of a gap, and that'll fill with fluid. But that will go, because you have a compression vest and you wear a very tight bandage. It's not very nice for a week. Between 5 days and 7 days. And then you'll wear your compression vest for the next 6 weeks, which actually helps with fluid. That was one of my complications, was I had a bit of, it wasn't big, it was minor fluid build-up on my left side. It was quite uncomfortable, so I went back to the clinic and got drained. I wasn't very happy with that, I didn't like it. I don't know what I was expecting when I went down. I went down to get help and I was like not really wanting it, but I had anyway. My nurse, absolutely amazing. Couldn't have asked for a better. Shout out to Abina, absolutely amazing. Couldn't have asked for a better nurse. She understood all my worries. I hate needles, hate them. And it took a lot longer than it needed to. So she actually got another nurse up to help me, which was nice at the same time. So that was a shout out to her. Incisions, they don't hurt. People have asked me if they hurt. They don't hurt that much. It's a weird one. They're very straight. Like, I'll show you them. I'll show my nipples. Right, they're very straight. Like, even at the ends, very straight. This one's like has a little curve, but that just depends on how your chest is. Like, you can't necessarily judge that. I asked for straight lines. I got them. You just have to ask your surgeon. That's like a major one. Just ask. Make sure you ask your surgeon if you're worried about something. Just ask them. They'll answer it. It's not hard. But I asked him just before I went into surgery. Probably not the best way I should have done it. When he was drawing the lines on, I said, please, can I have as straight as incision as possible? He has 20 plus years experience. I've always seen straight line incisions. Like, no offence, he had top surgery at London Welbeck. He had very straight incisions. And I got them very thin and very straight. Very, very thankful of that. People say, oh, this is a really odd one to ask, and I can understand why they've asked it. But is it weird seeing your flat chest like for the first time? I was very emotional. People have different reactions. A lot of people cry. I cried. I'm not afraid to say that. People are more in shock, or people don't cry. I've heard people don't cry. They're just like, okay. Afterwards I was like that, but at the beginning it was the build up. I had very severe anxiety and PTSD, especially with people like my chest, not only from dysphoria but also from past sexual abuse, and so that was a very, very difficult thing for me. I was happy. It wasn't sad tears, obviously. It was happy. But that was a big one for me. Yeah, I was happy. I cried a lot, so my images aren't like my chest is good, but my face isn't. But it wasn't necessarily weird. It was more like a relief than weird. It was like how it should have always been, because I've had like a chest for nearly 9 years, and so I've been binding for nearly 9 years, so it damaged my skin a lot. So it was weird not to be weird. It was like with surgery, I was nervous not to be nervous. Complication wise, yeah, the fluid build up on my left side, that was mine. It was only like 70 millilitres that came out, but oh my god, it was such a relief when it got drained. It was like at the end, it was like, ooh, I didn't think it could get any flatter. What? With the one whose part of my nipple graft failed, I was gutted. Honestly, I was. From the beginning, personally, I didn't. You know, when your own body, something's not right. To me, it didn't look right, but obviously I'd never been through it before. Didn't know. So it took a while, but people say it should only take 3 weeks for your scab to fall off your nipple. Mine took 6. Like, it was chilling. It was just didn't want to leave. So that came off quite a bit later. My right nipple was okay, but my left one, like, it hard to describe. It's like, so you have like your normal nipple, you have your areola. So it's got half the areola. It's like half failed. It's really, really weird how it's failed. But I'll sort a way of fixing that. I'm hoping not to be a tattoo. I'm hoping I can have a revision if possible. If not, I'll just have to bite the bullet and go for a tattoo, which doesn't agree with my own like feeling. I have tattoos here, there and everywhere, but my chest is not one from, again, past sexual abuse. I don't really like other people touching my chest, even just a tattoo gun. Like, nah, not for me. Not for me. Sensation, I like this question, but it is weird. So I'll show you. You know about my nipple now, so you can see the difference in size of my nipple. That one's like a lot smaller, and that one's chilling. It's good. So it means like sensation. I can feel all this. Like, that's like a bit lumpy still, but that's fine because it's still a bit bruised from when my fluid got drained. I can feel all this. I can feel all this. But then when it gets to like my nipple, like it feels a bit uncomfortable. Because it's still numb. I don't really have much sensation there. So it's like, imagine like a 2-pence coin on your arm, and you press down on it. You can feel the pressure underneath it, but you can't feel the surface of your skin. That's basically what it's like. Yeah, I don't really like people touching it. It's, yeah, odd. But movement, I can like lift that, but I can't lift this arm as much. It's got a bit like stiff. If I push it up, it'll go up, but that'll come in time. I do stretches every day. It's not the fact that I'm not doing anything with it. I'm doing a lot, but it just isn't happening. Sleeping. Ooh, it was uncomfortable. No other way about saying it, really. Uncomfortable. Because I stayed for a week post-op. Because I live about 2.5 hours, 3 hours away on train from the clinic. So we booked like an apartment, like very near. It was probably about a 15-minute walk from the hospital thing. And they had like a sofa bed, which actually the sofa bed wasn't comfortable like, in itself, but sleeping wise it made it a lot easier because I just prop myself up with pillows because it had like a little thing at the side which lifted up. Yeah, it wasn't that comfortable. I had to sleep partially up back anyway because my stomach disease, but actually yeah, when I came back, my bed's not really suitable for sleeping upright. I kept sliding down. It really didn't help. My swelling was going up, and that probably didn't help the fluid. I started sleeping probably about that, and when I woke up I was like that. So no matter how much I did, I even propped my feet at the end to stop me from sliding, but I actually woke up having pushed the little thing at the end. Like, it was like I've just filled a bag full of weights and it still moved it. So there's nothing I could do. I now sleep flat because I started sleeping flat for about 5 weeks, 4 or 5 weeks, because it wasn't working. I was comfortable. I wasn't in any pain. Yeah, it's not comfortable. People say get a mastectomy pillow. I thought, no. That's like things prior to surgery. Personally, I can't see the point. Like, just get a normal pillow, put it over your chest. You can even put an ice pack in the middle of it, but don't put it on your nipples if you're having the nipple grafts. Put it, I found if you're getting like a cool pack, not an ice pack, put it straight down the middle of your chest and then at your sides. Like that helped me. That brought all my swelling down. We were not very swollen when I'm a 7 day reveal. That was one thing for me. I was barely bruised. I can't remember if it was the end of bruising or end of swelling. I can't really remember, but it was one of them. One of them I didn't have, one of them I had a little of. So I was very lucky. Yeah, but things to buy pre-op. Personally, I won't get the mastectomy pillow. It's about 36 quid. I thought, after I paid so much for my surgery, I thought, no, I'll just use an on-pillow, make a substitute. But I also got these like, I don't think I have them in here. Like it's like travel sickness patches. You get one behind your ear and one put one on your stomach. They put them on for surgery. They help. Double them up if you want to. I don't know what they do. The herbal, so they won't harm you. But my gosh, they help so much. They smell odd as well. So if you've got anxiety, they actually help my anxiety by smelling them. And also get ginger capsules you can get from Boots or Superdrug, anywhere if you're in the UK. Don't know if you're in America. They help. I took 2 of them prior to surgery. I also took double of my stomach meds. Because I had major fear of being sick. It was one of the major ones I had from drains. Because I didn't want to be sick on someone. Like, I'm not about being sick, it's being sick on someone. But I wasn't, so I was really lucky. Requirements for top surgery. There's quite a few, I won't lie. You have to have a diagnosis of gender dysphoria. If you don't have one, I recommend go to the Gender GP or Evolve Counselling, I think it is. They were amazing. I can't ask more. It was 250 quid. It's a lot of money. If you can get it through the NHS, if you're already on the NHS, get it through the NHS. Trust me. You don't have to be on T for Mr. Agamel. Doesn't require it. You do have to, I think you do have to stop if you are on it. You have to stop to have surgery. But yeah, he doesn't mind if you're not on testosterone. As long as you have the dysphoria diagnosis, it's one of them. If you're non-binary, you need to diagnoses? I don't know. I'm going diagnosis for it. And your BMI, that's a big one. It's different for every surgeon, I think. I think for Mr. Agamar, it's under 20 or 30. So make sure, I think it's 30. So check with your surgeon. But if you're going Mr. Agamar, they will send you a massive leaflet on everything that you need to do before surgery. You also need MRSA test. That costs £90 if you're going private. Blood test, £50 if you're going private. You can get your blood test through GP. That is not an issue. My GP refused to do my MRSA last minute, so I had to pay private and go back down to London for 3 swab tests that took 2 minutes. So check with your GP, make sure you get a definitive answer before you leave it 2 weeks before your surgery like I did, and then panic thinking you haven't got your required stuff. You have to obviously quit smoking 6 weeks before. Take arnica if you can. I couldn't, but I didn't experience any itching, so I was really lucky. Arnica, like, you can get tablets. Take them, start 1 week before surgery. Your nurse will go through this with you anyway if you go with them, but that helps literally so much with your itching. I personally don't know, but I just know from other people's reviews, but I was not in any pain whatsoever. I was just in a discomfort more than anything. Post-op binder's not nice, it's minging. You smell, you can't shower for a week, sometimes 2 depending on your surgeon. But Mr. Agamar said I couldn't have a shower for a week. Then once I had my dressings off, I had to wait another 24 hours and then I could shower. But then you have to so I had dressings on, so you had tape. Don't have it here either. Tape across your incisions. Change them every 2 to 3 days, and then for your dressings for your nipples, you have to change them after you shower. Oh, I do have it here. So it was a micropore tape you have to put on your incisions. So that just helps with the redness, with the swelling, everything like that. That was a big one. I was so scared of showering that I actually don't know why I was so scared. I think I was just scared of showering my nipple off, to be quite honest, or opening my incision. Because I'm not going to be gory stuff. I'm alright with it now. Trust me, I'm alright with it now. But before I was like, oh, it's going to be so gory and everything. Don't get me wrong, it's blooming minging. But it was more your nipples that are gross when they're scabbing and they get wet. I'm glad might have to go through it again, but that is what it is. Like, within a couple of weeks, your incisions aren't so bad, because I had like a minor opening on mine, and it was a bit like mank. So, but if you're on your own, trust me, you'll get through it. I got through it. If you're with someone, if they're not like grossed out by stuff like that, get them to do it. But don't be scared. It's normal to be worried. If you want reassurance, message your nurse. That's what I did. Probably got annoyed with me, but that was a major one. Reassurance, message your nurse. Cost. Mine was, if I can remember rightly, 10,940. I think. I'm pretty sure it was that, because nearly 11. That includes your whole surgery, the pays the anaesthetist, surgeon, the hospital overnight stay, all the drugs, food, aftercare. Like, you get, with Mr. Ogamai, you get 1 for a year of revisions. That's like major for me. That was like one thing that went, I'm going with you. And yeah, so that was my price. I had to pay £250 for the consultation. I emailed them at the beginning of February, and I got my first consult in like a week or two. I did it on 15th of Feb, so a couple of weeks. Because I think it was a cancellation that they had. So I paid £250, got my consult. He was very reassuring, actually. I went in crying because I was so scared of my chest. I don't like anyone looking at it, but even like, I don't mind people looking at it now, but before surgery, I was absolutely nuts. I walked around Venice in a jumper, and it was like 35-degree heat. I was like, no one is seeing my binder bump. I forgot what I was saying now. But yeah, he was very reassuring it was very quick. So he went in, and he was like, why are you upset for? I was like, I don't want you to see my chest. And so he literally said, we'll get this bit done first. Literally took 20 seconds. He was just checking for lumps. And that was all it is. And then he had to take some quick photos, like 3 photos. And then that was all done, got back changed. And then he went through, so like all the complications that could happen, so like obviously nipple grass failing, fluid build-up, I forgot what it's called, like a blood clot thing. I'm really bad with this sort of stuff. I'm not very good with names. And then, so we went through all that. Then I got back on the train. I only said one day that day. Got back on the train, and then I got my email from Mr. Agmal with the price. And then I think it was only a couple of days later, I actually got my date for surgery. That was amazing. And then the fear started building the week after that. I was so scared. I was so nervous. I've been through surgery. I've had quite a few knee surgeries now. But this one's very big. It's very personal. Obviously life-changing. It's changed my life. My anxiety's got a hell of a lot better now. My depression's a lot better. My dysphoria, all my chest dysphoria is gone. I've just got hip dysphoria now. But that could be hidden. I can do stuff with that. That's not an issue. And when I start testosterone, that will also help, because I'm not on that yet. NHS taking its time. Movement. First week, I was like, I just thought I'd add that in there. It's TX arms. Now, I can like go, woo! This arm's a bit, because it's like, oh my god, that fluid build-up. And I'm not, even though I'm doing stretches every day, as I'm told to, I still can't lift it. Like, it's just like, yeah. So that's that one, but other than that, I could do it. I can now do sport again. I had my 6-week checkup last Wednesday. Oh my god, was it on last Wednesday? Last Wednesday. I felt ages ago. He said everything was fine. Obviously, my nipple gap, that's different. Start applying scar care. Obviously moving. Don't have to wear a band anymore. That feeling was amazing. He couldn't stop laughing at me. Because I was just so happy. I couldn't stop moving, and my nurse was trying to take tape off my scars to see them. And he came over and just told me I didn't have to wear a band anymore. So I was just like, whoa! And I got told off moving because she was trying to take stuff off, and he just couldn't stop laughing. It was so funny. But I just want to say something here. One thing I found with surgeons, quite hard to describe, with my knee, I think they were just surgeon, but I've heard from like other surgeons, they're there, they obviously want to give you the best results, but there's something that it's really hard to describe Mr. Elgamal. He's one of a kind, like, you don't get him anywhere else. But he changed my life, like, he genuinely did change my life. And this is not me kidding around now, this is me being genuinely serious. I don't know what I would have done without top surgery. I've said for so many years I'm going to have a top surgery this year. This was the year I saved up and I got my surgery. And I'm so glad I chose him. The way he cared about the surgery, he cared about the post results, everything like that. But the second I walked into that room, he cared about getting to know me as a person. He spoke about the past very briefly, like, got an idea, told him what I was scared of, why I was scared of certain things and stuff like that. But he got to know me as a person, and he could certainly tell from the first day I met him with a chest to post-op, even just last week, he could tell the difference in me as a person. And trust me, it saved my life. Like, it's the way he approaches certain situations, the way he's not so, like, he's serious about obviously what you have to be serious about, but he can have a laugh, and that's what you need in a surgeon. It relaxes you, it gives you trust in him, and it's not just, it's just a surgery to him. He knows the impact it has on a person, and that was so major for me. And he's such a lovely guy, and the nurses, honest to goodness me, I could not have done it without them. So I just want to say thank you to them. And lastly, how to refer, get off the seriousness because I'm not good at it. To refer, email, I'll put the email in the description, or just go on the website, search London Cosmetic Surgery Partners on Google. I'll leave the email in the description anyway. Email them, say exactly what you want, you don't need to say why you want it, they'll get back to you. It's quite quick actually, and that doesn't take long at all. And then they'll give you a date for your first consultation, obviously alongside your availability. That's basically it really. You don't really need much in terms of referrals. You have to email them. You have to pay for the surgery itself. You pay half when you book in to secure your place, and then half within 2 weeks before. So that's not bad. Like, it was a lot of money, but it was still life changing. I couldn't have asked, genuinely, I've said it before, but couldn't have asked for a better surgeon. And I'm so grateful to Lindsay, Abina, Mr. Elgamal, everyone at that surgery. I can't remember everyone's names. I have ADHD. I forget names. It took me a while to remember everyone's anyway. But than that, the staff at the hospital itself, they were beyond words. It's genuinely beyond words. My night nurse came in and told me off for not taking any pain medication because I genuinely was not in any pain. I wasn't in any pain for the whole thing. I was just, it was really odd actually. After surgery, I couldn't feel temperature. I was numb. Couldn't feel cold, couldn't feel hot, couldn't feel normal. So I just opened the window because I felt sick. So she came in at night and told me the room was absolutely freezing, and I just went, okay. So she shut the window and I felt sick again, so she could open it again. But she was amazing. She actually propped the window open with big pillows. That's a skill. But I had a breakdown at one point because I was on my own. And the nurse actually came and sat with me, calmed me down. And the nurse, who was actually like dedicated to me during the day, she was amazing. She understood my worries. She understood my anxiety out of it all. I wasn't that bad as I thought it was gonna be, but close to time, it's like 10 minutes to go under. I was like a bit nervous, and then my dad started crying, and then I started crying, so that didn't help. I actually cried on the operating theatre because my dad set me off before I went in. So while they were stabbing me with the needle, I was crying. But the guys were well nice. They were just talking to me, and within a second, out. Then all of a sudden, I was in a recovery room that I don't really remember. I just remember seeing Mr. Elgamal come in and show him a picture. If you want a picture, that's the point. If you want your picture, if you don't want to wait a week, I couldn't. I'm not patient enough. What you have to do is ask Mr. Elgamal for your top surgery photo at the end of your surgery. He'll come in. I don't know when he'll come and see you, actually. I can't exactly say that, but he came in and saw me straight after, once I'd woken up, I got told, and then he came and saw me in my recovery room, my private room, because I was still a bit groggy in the first time he saw me. So he came and showed me again. I was like crying again because I was so happy and so drugged up. They're good drugs that they give you. But if you feel sick after surgery, if you're worried about that, just tell them. They'll work with you. They'll give you stuff. But yes. Thank you for watching. Follow me on TikTok, follow me on Instagram, and I'll see you in the next video.